Abdominal scan. Abdominal scan, we start from the epigastrium. We will put the probe transversely and we will try to see the linea alba. This is skin, and then we have the linea alba here. So we are concentrating on this part instead of pancreas and everything in the beginning, and then we will keep on scanning. These are the pancreas in the epigastrium, and whereas you can see this hyperaquic wall, and this vessel is superior mesenteric artery, and then we have splenic and portal veins. This is called portosplenic confluence, and then we will have aorta and IVC here at the base. You can see them separately. This is how we measure, labeling it. This is tail, and then is the color. So the way of scanning is that scan on grayscale, then Doppler. If you need spectrum, perform the spectrum and go to the next viscera. Don't do it in that manner, that finishing everything on grayscale and then putting the color Doppler, because color Doppler is the part of your systemic examination. It is not something separate to be done separately. So if we need, we can assess superior mesenteric, celiac trunk and other things. Here is the right lobe and left lobe of the liver with the gallbladder. This is the gallbladder, and here is the left lobe, right lobe. So if you want to measure right lobe, you will measure from here to here, because gallbladder and this area is left lobe and right lobe is this one. So it is better to measure from this top to this area to measure the AP diameter of the right lobe. This will be with the caudocranial, superior to inferior of the right lobe. For left lobe, we have to bring whole of the left lobe here, measuring from the maximum width and maximum height. So this will be the caudocranial. We need 7 measurements for abdomen. What are the 7 measurements? AP diameter and caudocranial measurement of right lobe, left lobe and caudate lobe. 6. The 7th measurement is you will put the probe in the mid-clavicular line and you will try to assess the total length, which is normal up to 16. In our countries, internationally 15.4 centimeters. So there is caudate lobe also. This is right lobe. With gallbladder, you can measure the wall of the gallbladder also. Here is IVC, and this one is the caudate lobe. Here is the caudate lobe, fissure for ligamentum venosum, duodenum. Here you can see portal vein, IVC. This is all assessing the caudate lobe, left lobe, measuring the caudate lobe. Normally is 2.5 is AP diameter, and about 7 will be the length. And this is how we measure the caudocranial measurement of the whole of the liver. The kidney must be there. The probe is placed mid-clavicular line, and we will measure from the center of the dome this oblique line which is measuring the caudocranial. This is tip of the left lobe, end of the left lobe, and here is the pouch that Morrison's pouch. This is left lobe and segments. These are the hepatic veins, right and left and middle hepatic veins. This is portal vein. We can use color Doppler and spectral Doppler on portal vein. We can see the hepatic vessels also. Renal vessels and hepatic vessels. This was portal vein. Here we are assessing the portal vein on spectral Doppler. Then is kidney. The head is upward and outward, and it is with color and without color. You can see the right kidney. Then make the measurement. Transverse. So we can have 3 measurements: longitudinal and the AP view and transverse view. This is linea alba. IVC, portal vein and quadrate lobe with Doppler. This is gallbladder measurement. Portal vein, main portal vein. We can measure the width and we can see it on Doppler. We have also seen it on spectrum. Pancreas again. The white area is the pancreatic duct in the center. We are assessing all these vessels with the spectrum and color Doppler. I am not going in detail of them. The aorta and IVC assessment on Doppler. So all this is part of abdominal scanning. Then is urinary bladder and left kidney with spleen. This is the renal scan on Doppler. The abdominal scanning is to be done in 15 to 18 minutes. So we have to do all this. Look at this renal artery scan. People spend 30 minutes on it, but if you are expert, you can do it easily. This is how we get it. Veins and arteries. This is again the renal artery. Spleen. These are the splenic vessels. How to measure the spleen. These are the abdominal vessels longitudinally.